Big Money Bound TV, RRT Posse YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. As a travel respiratory therapist, there are some things I have learned. One of those things being seniority amongst the travel respiratory therapy staff plays a huge role in your assignment workload. Where your assignment will be, what you'll be doing, how you'll be doing it. Seniority amongst the travelers? What in the hell am I talking about? If you want to know more about what I'm talking about, just keep watching. Keep watching.
We represent, man.
Big money bound.
So let her know, man.
Big money bound.
The kids, man. We got the kids, man.
To understand what I'm really talking about, first you must understand how an assignment for a respiratory therapist that's clocked in to work is broken down. Vents normally count for like 6 points. Let's say you're going out with a count of about 36. I give my therapist who's here, that staff here, I get them 6 vents. 6 times 6 is 36. That's their workload. 6 vents. Q4 checks, 6 vents. Not the hardest thing to do. As a travel respiratory therapist, you ain't gonna get those 6 vents. Now, a more busier workload would be if I gave you 36 patients that each have a breathing treatment apiece. One treatment counts as 1 point. So you're gonna have to get 36 treatments. Let's say that's 36 patients. So you gotta go in there 36 times. Bing, respiratory therapy, here to give you a breathing treatment. This is a bronchodilator, keeps your lungs open, help you breathing nice and easy. It has cultural indications, tachypnea, your heart rate may go up, tachycardia. Oh, you gotta do that 36 times. Now those 36 vents, you go in there, you do your vent checks and do all that stuff, and you just, it's different. Now that we understand how a respiratory therapy assignment is tallied up and counted, let's move on. You gotta stay with me. As a traveler, you have your orientation. You go your orientation, you do your onboarding. You have your day of like training. In my situation, how I learned that seniority plays a huge role in where you work at in the hospital and what you're gonna be doing while you're in the hospital. My first day there, I was being trained in the units. I was being trained in the units how to document the vents, because they're already assuming anybody can do like floor therapy. Let's train you on how to do these vents. Let's show you how this is done over here. That's what I did. That next day, I started to work by myself. Floor therapy. All you get is floor therapy. Floor therapy. For 3 months, I was given floor therapy. Then I begin to realize travelers that have been there before me started to leave. Now, I'm getting floor therapy and 2 vents. So I got less breathing treatments to give, less patients to sit on the floor, and I'm in the units now. I've been here for quite some time. So the level of seniority has some effect on your assignment. You gotta keep listening. So, okay, I realize what's going on. So let's say there's some people in places where you may not want to work. They may be in the COVID area. You may say, I don't want to work COVID. What you got to do is, that travel therapist that's always working COVID with them units, COVID ICU, when they leave, you bump it up. Because people coming behind you, they get nothing but floor therapy. You've been here a little bit longer, you're bumping up, you're bumping up. So keep an eye on that if you focus on leaving. My situation that took place, I've been doing floor therapy for the last 3 months. People started to leave. Now I'm doing floor therapy and I'm getting a couple vents here and there, occasionally. Not nothing major. Every time I come in, I'm getting a vent, just occasionally. Now, someone that has been working the ER for the last 1.5 years as a travel respiratory therapist has now up and left. I come to work the next week, I'm in the ER. have no problem with working the ER. I work ER in many hospitals. That's no problem. The problem being that I was never oriented in this hospital how to work the ER. And then I just come working. I'm covering ER? Randy, what you mean you don't know how to work the ER here? Everywhere you go, the job is performed differently. I don't know how these people like do their intubations. I don't even know where they keep the equipment. I don't know what the vents are. I don't know what the holisters are. I came in, I had ER. I went down to the ER. I said, hey, to the therapist that was leaving, give me a report. This is my first time down here. Can you please at least show me around where they keep the vents at? Where's the equipment? So if anything happens, I know where to go. Homie walked around the ER with me one time, very detailed. I appreciate him for that. And then I was on my own. I'm thinking to myself, this isn't how this should be done. How this should be broken down, in my opinion. I see we have tribal therapists that's on the verge of leaving. And we gotta step some people up. Randy, you been here a while? You on deck. Your time is coming. That's cool. I'm a respiratory therapist. I work. That's no problem. You're gonna be in the ER soon. Okay, cool. Today you're doing floor therapy. When you have your downtime, I want you to go down to the ER and shadow the person that's working in the ER. See what they're doing, where they keep their transport ventilators at, where their respiratory offices at, how they run the ABGs, how the cold blues are set up, and what's your role in that cold blue, because everywhere it's a little bit different. Your role in a cold blue may be assist the doctor at the head of the bed. You stay at the head of the bed. The nurse brings you the intubation bag. Some places have a bag, not a whole box. They bring you the bag. It has the blades in it, the ET tubes, the style, everything you're gonna need, and then you break it up from there. Some places, they hand you the tube, the blade, and you just assist the doctor in like securing the ET tube. So I don't know which one this is. Until I get down there, now I'm in the cold blue, and they saying, respiratory therapy, where's the glide scope? Bro, I don't know. I'm asking you the same thing. I've never been in a hospital where the glide scope was the responsibility of the respiratory therapist department. That's always something that they'll keep in the ER for the doctors who want to use the glide scope. Because where I'm from, you do a Mac or Miller blade. We don't got time. I want to see a picture. I want to get a good camera vision, 3D, 4K. That's normally for people that's scared. So I'm like, hey, I don't know, man. The nurse was like, oh, we have it here. Cool. That could have went into something else. What do you mean you don't know? Hey, like I said, I don't know. Hey, I don't know, bro. The seniority role plays a huge part in that assignment. That's what I started to realize as people begin to like leave out and folks begin to come after me, and I began to get pushed up doing like more like critical things like the ER, the intensive ICU, that situation. The ER situation was something that was like, it was something that didn't sit well with me, just the transitioning. It could have been a lot smoother. Not to say I didn't do my job as a respiratory therapist. I'm just saying the transition could have been a lot better. Lastly, I'm gonna leave you with this. Lastly, I'm a traveler here. This isn't my hospital. If anything happens and they ask you for anything, hey, and I don't know, my answer is to them, I'm new here. I'm new here. Haven't been trained here. I'm new here. So you can run with that. Now, I'm not going to go in there and hurt nobody. No. But I'm new here.